You have cells called glial cells. As I mentioned a few minutes ago, the glial cells are like those repairmen to replace your tires and retread, if you could, retread a tire. Well, the glial cells do that for your body, for my body, for every person's body. The glial cells reproduce myelin. What would happen when the glial cells, they're not on vacation, but when the glial cells are infected? What happens when the glial cells have a sedative that has been absorbed into the glial cells and they're sedated? What happens when there's an anesthesia chemical that was provided you to do a surgery and the anesthesia chemical got into the glial cells and they are, if you will, asleep, so to speak? What happened if a dental anesthesia chemical that was put into your jaw that numbed your mouth to pull a tooth or drill a filling in, drill in a cavity and put a filling in a tooth, or change the mercury filling to the white filling? That's supposed to be a good thing to do. What would happen? I'm not saying it's a bad thing. That's not what I meant when I just made that statement. But I will tell you that the anesthesia chemical that the dentist put in your mouth, and no fault to the dentist, no fault to the drug company. That's not what I'm saying here. But the chemical that was put into you that's toxic, that will destroy your body's ability to sense anything going on. When your mouth is numb in the dental chair, you can't sense it. And even it can paralyze your tongue. It can paralyze your ability to speak, swallow, spit. If any of you have been in a dental chair and they put that numbing chemical in your mouth, you know what I'm talking about. So when that numbing chemical is in there, 4 or 5 hours later, it starts to, let's say, evaporate or disappear, and you get your sensory back and your motor function restored to your mouth and speaking and swallowing and spitting and so on. Where did that chemical go? Did it just evaporate into thin air? Did you exhale it? Did the numbness go away because you already processed it through your kidneys and it left, when you went to the bathroom, when you urinated? No, that chemical gets into the bloodstream, that chemical gets into your nervous system, and it can travel to the glial cells and impair and stay there like a stain, like a tattoo in the skin, and impair the glial cells' ability to protect, repair your nervous system, and reproduce the myelin. So what happens when they're numb to their proper cause that they're supposed to be doing by reproducing the myelin? They can't reproduce the myelin.